Thousands of Texans, especially Hispanics, are in urgent need of organ donations.
One father of three is encouraging people in the Basin to register and save lives. Our very own Adriana Gonzalez Chavez has the details.
Think about the life you could be saving, not so much of the life that you think you're going to give up.
Donate Life Texas tells us that 40% of Texans waiting for an organ transplant are Hispanic, and 44% of Texans are still not registered as organ donors. Jason Dominguez is one person waiting for an organ transplant. He has been searching for a kidney donor for the past year, and he prays that he can find his match soon.
Less time spent with my family because I would have to connect to my dialysis machine. That really took a toll on my mental health, having to tell my kids that we can't go to the park because Dad has to do this, and they understood it, but for me it was just feeling like time was being taken away from me.
Each year, about 6,000 people die because they do not get the organ they need in time. Irma Primo received her life-saving transplant nearly a decade ago from a woman she styles hair for.
You wouldn't believe the people and how good they are and how they're willing to give. Around here, they're willing to give whatever they can just to help.
Primo was born with chronic kidney disease and was on dialysis for 4 months before receiving her transplant.
I love her and she knows it. I told her thank you very much for giving me a new way of life.
Donate Life America shares while transplants can be successful regardless of race or ethnicity, the chances of long-term survival may be greater if the donor and recipient are closely matched in terms of their shared genetic background. Future donors can save up to 8 lives, and up to 75 lives can be saved and healed when someone donates tissues.
You're giving somebody actual life. It's amazing.
Dr. Anand Reddy with the Permian Basin Kidney Center notes that the need for organ donors in the basin is urgent.
So the number of people waiting for kidneys in the Hispanics are going up. And the donation from the Hispanics is also going up, but they're not matching.
He encourages people to get tested to see if they can match with someone in their community.
Organ donation is not going to affect their own health. Most patients who donate their kidneys, they should not worry about them having any issues with either their kidney disease or getting any heart diseases or blood pressures, things like that. Organ donation is simple. It saves a life.
Dominguez looks forward to the day he receives his kidney transplant.
I can provide a better life for my kids. And that's my main goal, give them the life that I never had.